Good afternoon, everybody. Welcome to Grand Rounds today. I have the pleasure of introducing Ellen Heikens. Ellen received her PharmD degree from Drake, and she has been on the staff at MGMC since 2016. She's been an inpatient and clinical pharmacist. She very graciously has accepted our invitation today to speak on what I think is a really important and really interesting topic, and that being over-the-counter medications in older adults. And please join me in welcoming Ellen Heikens.
Thanks. Yeah. Thank you. Like you said, my name's Ellen. I'm one of the pharmacists here. I've been a pharmacist here since 2016. Right now, I primarily practice on 4C. Med Tele, that's usually where you'll find me, in the back room over there. But today I'm here to talk about, like you said, over-the-counter medications and their impact on older adults. So we do have a few learning objectives. First of all is just overall using over-the-counter medications safely, gaining confidence when selecting or recommending over-the-counter medications for patients, maybe considering a non-medication option for treating over-the-counter conditions, and then identifying when maybe we've reached our limit of treating things over-the-counter and maybe we need to refer to a provider. So a couple of housekeeping things kind of before I get started. This is mostly information for older adults regarding over-the-counter medications. I'm primarily using generic names of the medications, but their brand names are listed there for reference. I'll mostly talk about single drugs and not combination products, although we will touch on kind of the differences towards the end. I don't have any particular preference for any generic manufacturer over the other. There are quite a number of pictures in here, and I tried to get a good variety of generic manufacturers, but do not prefer any of the ones that have a picture listed here. They just kind of were what I normally saw over the counter when I was looking around. I will typically not really talk about therapy and dosing for children. I will not talk about specific dosing, and I'm pretty sure you don't want to listen to me regurgitate doses of over-the-counter medications over and over and over again. We'll cover how to find them on the label and how to figure out what we're doing. And then this is mostly like over-the-counter use, so some of these medications are used differently in the inpatient setting or under the supervision of a provider, so we're not going to talk about them in that regard. All right, let's get started. So what is the difference between an over-the-counter and a prescription medication? The big difference is that prescription medication requires medical supervision for use, where an over-the-counter medication does not. And a prescription medication has potentially some potential for abuse or misuse. Of note, it's kind of interesting, some prescription medications are actually over-the-counter medications at higher doses. A great example is ibuprofen. You can get 200 milligram ibuprofen over the counter, but once you get to like 600, 800, those are prescription only. So the over-the-counter medication labels, this came from the Drug Facts Regulation in 1999. It requires that there's a standard format and content for all of the over-the-counter medication labels. It needs to be in simple language, needs to be easy to understand, and this usually gets a laugh, but it does need to be large enough to easily read. So you'll notice that they do sometimes do creative things to make it easily readable. You might end up, unveiling a little CVS receipt there to get all the directions, but it does need to be readable to most people. If it looks kind of familiar, it's patterned after the Nutrition Facts food labels. So food labels, drug labels, they did purposely kind of make them similar so that people kind of have a reference. As far as reading over-the-counter medication labels, again, they do go in a standard format. The first thing that you should see right in there is the active ingredient. Secondly, should be the uses for the product or the purpose of the product. Below that, you should see the specific warnings. So when maybe we should not use a product, when maybe we should talk to a provider about the product, what are some possible side effects, and then also like substances and activities to avoid. So especially if the medication makes you like drowsy, then driving or avoiding alcohol are advisable with that. Underneath that, there will be dosage instructions, so it should say pretty specifically when, how, and how often to take the product. And then below that will be some handling and storage information, and then some information about the inactive ingredients. So you can kind of see, like, if you're allergic to a particular inactive ingredient, I know like a lot of dyes or gluten-containing ingredients, you should be able to see that right there on the label. So what's different about older adults, especially regarding medications in general? As we get older, our blood-brain barrier thins a little bit, which makes medications more likely to reach our brain. Our liver and our kidneys are not processing and eliminating the drugs quite as effectively. So overall, in our older patients, we notice that, drugs may have more side effects. The side effects are more likely. Older adults are also more impacted by like adverse drug reactions just from the medication overall kind of working more strongly. So what are some specific considerations for older adults? There are quite a number of disease states, including diabetes, heart failure, kidney disease. There are drug interactions with prescription medications. A big one that we'll talk about is NSAIDs and blood thinners. And then really a thing to always be considerate of when selecting medications for older patients would be anticholinergic medications, which we'll cover in just a second here. And then really anything that can increase their risk of falls or cognitive impairment. So what is an anticholinergic medication? An anticholinergic medication is any medication that blocks the neurotransmitter acetylcholine. So that's kind of where it gets its name from. Acetylcholine acts in our sympathetic nervous system as part of our fight or flight response. So when we want to kind of use these to our advantage to maybe treat a condition, it works really well. But when it's acting on non-target organ systems, that's typically when we see that there are side effects. So a lot of bladder medication, we kind of want to slow down that like gotta go feeling, but then we might notice that, our mouth is really dry, or we might notice some constipation because our GI tract is slowing down a little bit. So what are the main side effects of anticholinergic medications? Dry mouth, constipation, kind of that dry, hot, flushed skin, increased heart rate, difficulty urinating. There are quite a number of disease states that it's not really recommended for. So like glaucoma because of our eyes, asthma, emphysema, anything kind of with our lungs, high blood pressure. And then we want to be particularly aware of any kind of medication issues or confusion, and then anything that can make us more prone to falling. So I think in pharmacy school, whenever we talk about anticholinergic medications, you're kind of obligated to put a picture of the desert on there because that kind of mimics what we kind of see are our anticholinergic side effects. You're dry, it's hot. In the cartoons, people usually like see a mirage, they get confused. So if that helps you kind of remember the side effects, that's kind of a useful tool. Another really easy way to check if a medication is maybe safe or not for a patient is to just quick check the Beers criteria. This is just a list that is used to assess inappropriate drug prescribing for older adults. It was most recently updated in 2023, so it's been pretty recently updated. Several over-the-counter medications are included. These are primarily antihistamines. However, I will never tell a patient to just stop taking a medication just because it shows up on this list. I think of it more of like a warning light rather than a stop sign. It may be something to discuss with your provider. Is there an alternative? Maybe do we need this anymore? But this is really kind of a way to assess risks and benefits for older patients. So now we'll get into individual medications themselves, starting with allergy medications. So first is our first generation, are kind of our older antihistamines. These are definitely our more sedating antihistamines. They're more lipophilic. Basically, they're more likely to cross into our blood-brain barrier, which can give it to a moderate to a strong anticholinergic side effect, which is not desirable for older patients. There are a few medications that are commonly seen over the counter. Diphenhydramine, doxylamine, dimenhydramate. They can be in a variety of medications, but overall, really, these are not recommended for older adults. And if there's like a big takeaway from this presentation, this is probably one of them. Again, they have those moderate to strong anticholinergic effects. They're really notorious for causing confusion and drowsiness, increasing our risk of falls, and then overall just worsening our cognitive impairment. When I go teach at Key's course, Keys to Dementia Prevention, this is the bulk of what we talk about is kind of our anticholinergics and our antihistamines and avoiding these medications over the counter. So then we have our second generation. These are kind of our newer antihistamines. Again, these are less lipophilic, so they're less likely to cross our blood-brain barrier, which means that their anticholinergic effects are more mild. I do have them here in order from kind of least sedating to most sedating. So I guess when patients ask me kind of which one to start with, like I'm new to seasonal allergies, what should I do? I typically tell them to start kind of with that loratadine and that least sedating one. And then it's just kind of trial and error, work your way up and see what works for you. They are also useful for cold symptoms, hives, insect bites. You can use them, all throughout your allergy season or just as needed, if you have like some itching. Nasal steroids, these are a great option for allergies. There are now 4 nasal steroids available on the market. Fluticasone, that's probably the one that's the oldest and people know the most about, but there is triamcinolone, budesonide, and azolastine. That one's the newest on the market as of last year. They're really great at treating nasal allergies. They help with inflammation, nasal congestion, and I really like to recommend them because they work right at the site of action. They're right there in your sinuses where you're having the bulk of your symptoms. They can cause a little bit of headache, sneezing, or stinging. That's usually if they're not used properly. And again, if they're not used properly, they can also cause some nosebleeds or possible a little bit of throat irritation. So when we talk to patients about properly using nasal sprays, it does end up being a little bit counterintuitive. People usually want to follow the shape of their nose and go inward, but actually you want to point it towards your sinus and go outward. So really just, making sure our nasal passage is clear, tilting our head forward and breathing out, and then really pointing it there towards our sinus and really as far back as you can go, get it really far back in your sinus. Usually if you feel it dripping down your throat, that means you haven't quite got it all in there. And again, that's usually where that irritation can come from. So what are a few non-medication options for allergies? Spicy foods is one option. I don't know if you've ever watched somebody eat like a pepper that's way too hot, makes your nose run. Maybe we don't want to do it quite on that scale, but a little bit of spicy food can help kind of clear out that congestion. Honey is a great option. Honey and water. Can help soothe your throat. And actually, the more local honey you can get, it's kind of like low dose exposure to pollen. So it can also kind of longer term help with allergies. Drinking water, as far as non-medication options, I think drinking water comes up in every topic. So really just making sure you drink plenty of water always. Air purifiers and HEPA filters, those work really great indoors for keeping allergens out of the air. Nasal washes, again, they make like saline nasal sprays that you can just buy as itself. If you want to use a neti pot, that's fine, but always make sure that you're using clean distilled water and not tap water in those. And then overall, just avoiding allergens. So in the morning is usually when pollen counts are highest. So if that bothers you, trying to stay inside during those times, or potentially, wearing a mask, especially if you're like out in plants, digging up a bunch of allergens, making sure just to keep those out. So as a summary, for older adults, nasal steroids are usually my first choice. There's not any worry of anticholinergic side effects, and they're pretty easy to use. Second generation, or those non-sedating antihistamines, those are probably a pretty good second choice. And again, you can kind of go through that list of like least sedating to most sedating. It's usually, like I said, trial and error to figure out which one works the best for you. Really just overall avoiding our first generation antihistamines. Those do have really strong anticholinergic side effects and are really notorious for causing confusion and like kind of drowsiness, dizziness. Always monitoring pollen counts and staying inside if that's what bothers you. And then if you're not improving at all, taking these over-the-counter medications, or you have signs of an infection, it's probably a good idea to just talk to your provider. So sleep aids. This is like a little bit unnatural segue, but I promise it makes sense in just a second here. So PM formulations, as far as sleep aids, these are readily available and very popular products over the counter with acetaminophen, ibuprofen, but really the issue with these is that they almost always contain a first-generation antihistamine. They're taking advantage of that drowsiness side effect of that first-generation antihistamine, and again, those have the strongest anticholinergic effects, so they work kind of the best for making us drowsy. But again, you get all those other side effects that come along with it. The dry mouth, the constipation, the dizziness, the confusion. So really not recommended for older adults. If you know somebody who is taking these to help sleep, try to recommend that they do something else because again, those anticholinergic effects can really impact people, especially when the medications are used long term. Melatonin is another product that a lot of people use as far as a sleep aid. This is not an anticholinergic medication. This is actually like a supplement type of product. There is a mixed level of efficacy. And again, it's a supplement product, so you have to be a little bit careful about which one you buy. But overall, when people ask me kind of where to start, I usually tell them, 2 or 3 milligrams. It kind of just depends on what you can buy at your store, but 2 to 3 milligrams to start. Typically when you get into higher doses, that's when people have kind of the crazy dreams or like the nightmares. So you kind of want to avoid taking too high of a dose. And then they actually do work better if you take them like quite a while before bedtime, like 2 or 3 hours. That kind of mimics what your body's doing naturally with its own melatonin and works a little bit better to help you fall asleep. Obviously it is sedating. That's kind of the intended effect. So you want to avoid any kind of benzodiazepine or sleep medication along with it. And then again, avoid driving due to sedative effects. So what are non-medication options for sleep? Really, sleep hygiene is the number one thing that you can do and recommend for your patients to do to help with sleep. Having a routine, sleeping in a cool, dark room, avoiding screens. I know I really struggle with that one, but especially in the hour or two before bedtime, if you can get off the screens, that really helps you sleep. Large meals, limiting napping, avoiding avoiding substances, caffeine, alcohol that can, help keep you awake. And then, I went away here. Sleep hygiene is really the best thing that you can do. So in summary, again, sleep hygiene is really the best thing and probably where you should start as far as recommendations for patients who are having issues sleeping. Melatonin, it can be worth a try. That is on our admission order set as far as our recommended sleep aid for patients here. Other over-the-counter medications for sleep, just avoid them. Again, they almost always have a first-generation antihistamine in them, and they have pretty strong anticholinergic effects. If your sleep issues are ongoing or they're not helped at all by any of the sleep hygiene or other things that you've tried, it's really worth going to a provider and having that checked out. All right, cough and cold. So for dry cough, you're really looking for an ingredient called dextromethorphan. They have a regular release and an extended release product. The extended release product works really well for like bedtime coughing. Kind of covers you a little bit longer so you can get some sleep. You see a product that says DM on it. It's usually referring to dextromethorphan. Cough syrups. A lot of these do come in cough syrup form, which are typically very high in sugar. So diabetic patients should just caution using these, especially for an extended period of time, because they can impact that blood sugar. And then they do come with measuring devices for a reason. It's very tempting to not use them, but do always make sure that you're using the provided measuring device and getting the correct dose. For wet cough, you're basically looking for an ingredient called guaifenesin. This is a really good product. It kind of helps loosen up your chest congestion, and then it's easier to cough up when you're done. Always take it with plenty of water. That also helps loosen up chest congestion. Again, this one can come in cough syrup form too. So we do need to be mindful of our sugar content and then always using our provided measuring devices. For congestion, I'll say there were 2 products over the counter that were mainly used for congestion. Sudafed, again, this one has a reputation for being used illicitly to make illicit drugs, but you can still buy it over the counter. You do have to go talk to the pharmacist at the pharmacy counter to buy it now. But if you're buying like any product that says like D, like Claritin D, Mucinex D, the D means decongestant, that typically means that it's got pseudoephedrine in it. Phenylephrine is another product that I believe is still on the shelves, but we'll talk about that in just a second. They are both pretty stimulating, so it's a good idea to take it earlier in the day to avoid any kind of sleep issues. They really should not be used in patients with high blood pressure. Again, they work by causing vasoconstriction, so obviously that's going to make blood pressure issues worse. And same with diabetes, they can increase your blood sugar. So as of September last year, the FDA kind of came out saying that phenylephrine as a decongestant is no better than placebo. It's not harmful, it's not unsafe. So, if you have medications with it in there, but just don't expect it to help with your congestion at all. It's still kind of under review whether they're going to remove it from the shelves. Nasal sprays are another option for congestion. These are a little more controversial. Some providers really like them and some don't. For people who shouldn't use oral decongestants, they're kind of a better option. And for bedtime, this is usually when I recommend that they get used. The issue with these is that you really have to limit them to 3 to 5 days of use. Basically, they cause your mucous membranes to swell a little bit after you use them. So then after about 3 to 5 days, you're kind of congested anyway just from using the product, and it becomes kind of a self-fulfilling prophecy. So being really strict, limiting your use to 3 to 5 days with these is really important. But, if you choose to use them, they are good products. For cold prevention, I just wanted to touch on this quick because I get asked about these a lot. They are really popular products. A lot of them come in that effervescent tablet form. You can drop them in water and drink it. Vitamin C and echinacea are the 2 big ones. However, echinacea is a substrate, so it does have quite a number of drug interactions. Tacrolimus is a big one. Actually, caffeine is a big one. So you do need to kind of be careful what medications patients are taking if they're also using these products. And then those effervescent tablets are pretty notoriously high in sodium, so heart failure patients should also be cautioned against using them. Since this comes up the most in cough and cold medications, I just wanted to talk really quick about single versus combination medications. When I'm recommending products, I typically only recommend single drug medications. That way, they're only taking exactly what they need based on exactly the symptoms that they currently have, and you can combine them if you have multiple symptoms. They come in combination products anyway, so if you want to use a couple at a time, that's perfectly fine to do. What happens with combination products is that they often have like 1 or 2 ingredients that you're not having symptoms for. Cold and flu medications especially often have a first-generation antihistamine in them. And then the combination products almost always have acetaminophen in them, which makes it really easy to accidentally take too much. So here in the picture, actually, I have kind of the most egregious offender, which is the NyQuil Severe. So, if you have a cough maybe that you're trying to treat, then you end up taking this product, you're getting that cough suppressant, which is actually kind of what you're looking for, but then you're also getting additional Tylenol, you're getting doxylamine, which is a first-generation antihistamine, which is not desirable, and then that phenylephrine, which we already talked about, is no better than placebo at treating congestion. So you're getting kind of 3 things that you weren't even really intending. As far as non-medication options, really, again, making sure you drink plenty of water or fluids is a great way to help a cold. Just making sure you rest. Shower steam can help with congestion. Again, saline nasal sprays or drops, and then salt goggles can help for sore throat too. So, really quick summary. Dry cough, you want dextromethorphan. Wet cough, you want guaifenesin. You may choose to use a nasal spray over an oral decongestant, but just be really strict, limit it to 3 to 5 days. Unless it's saline nasal spray, then you can just use it like unlimited. Drinking plenty of fluids and getting plenty of rest is probably the number one thing that you can do to feel better fast. And then if your symptoms worsen or you develop a fever, that's probably when it's time to see a provider. All right, GI medications. So heartburn. As far as antacids, that calcium carbonate or Tums product is probably our fastest acting one. These histamine receptor agonists, these are kind of shorter acting for treating heartburn. They do carry some anticholinergic effect, so do be mindful of that if you're recommending them to older patients. Famotidine is probably the most popular one. Ranitidine, Zantac was recalled in 2020, so if anybody has ranitidine on their shelf anymore, be sure to get rid of it. Basically, they found when it degraded or got expired, it contained like a potential carcinogen, so they just took it off the market completely. So especially at this point, if you have ranitidine, it's probably expired and not safe to take anymore. PPIs or proton pump inhibitors, these are a little bit longer acting. Omeprazole, lansoprazole, esomeprazole. Omeprazole does carry a drug interaction with clopidogrel or Plavix, so if patients are taking that, we don't recommend that particular PPI, but these are a little bit longer acting and can be used for a few days in a row to help treat heartburn. Diarrhea, there are a couple products for diarrhea over the counter. Loperamide or Imodium, again, this is kind of more for like a traveler's type diarrhea, an infectious diarrhea. We don't really want to stop. We kind of want to get that bug out of our system. Bismuth subsalicylate. This is also another product. I don't typically recommend this product. It can cause kind of a black tongue or a black stool. So patients who are at increased risk of bleeding, that can cause confusion as far as kind of what you're telling them to look for internal bleeding. Also, it carries a number of drug interactions, most notably with warfarin, valproate, and methotrexate. So really high-risk medications that we don't want to have interfered with by an over-the-counter medication. It can also cause Reye syndrome in children, so being really extra cautious not to use that in children. Probiotics are available over the counter, especially for preventing antibiotic-associated diarrhea. Refrigerated options are Fluorostored. That's what we carry here in the hospital. So if you're looking for those type of products, those are probably good ones to look for. Constipation, this is a pretty big complaint with older patients. So luckily there are a number of options to try over the counter. I have them kind of here in order of kind of where to start and then where to go as far as recommendations. So really where you want to start is increasing fiber content. So you can either do that through dietary fiber or methylcellulose, psyllium fiber. Those are really popular products and work really well, just kind of as bulk forming agents to decrease constipation. If that's not working very well, polyethylene glycol, that's a really great product. I recommend it all the time. It's just a powder that gets dissolved in liquid. Literally any liquid it can get dissolved in. The only difference is that it dissolves a little bit slower in colder liquids, a little bit faster in hotter liquids, but really doesn't matter. Glycerin's also another option, kind of secondarily. Flea suppositories. Suppositories aren't very popular, but they are an option to treat constipation. After that, you can try stool softener. Docusate is the main stool softener that's available over the counter. There's not a whole lot of evidence of efficacy. American Journal of Gastroenterology recently came out with a couple of review articles, again, saying it's no better than placebo. So I sort of wonder if it will get the same treatment as phenylephrine got as far as efficacy. Then there's stimulant laxatives. Again, these are kind of a last resort for treating constipation. And again, if you find you need them for more than a few days, it's really a good idea to talk to your provider. You can become kind of dependent on them to go. So you want to make sure that if you're using them long-term, it's under some supervision. It's a good idea to be mindful that there are a number of medications that can cause constipation. So looking at this before maybe recommending a whole bunch of over-the-counter medications is a good idea. Narcotic pain medications, anticholinergic medications, antihistamines, benzodiazepines. A lot of medications that older adults are commonly on are pretty notorious for causing constipation, and maybe looking at alternatives or different formulations that will not have as strong of an effect is always a good idea, and just keeping that in mind when we're prescribing these. So for GI issues, again with constipation, making sure you drink plenty of water is another really great thing you can do to help kind of soften up your stool naturally and get it to pass. Again, dietary fiber is a great idea. Fiber is probably the first thing that anyone should try if they're feeling constipated. And again, looking at our disease state or medication causes and try to eliminate kind of that causal factor instead of just trying to treat it after it's a problem. Diarrhea, again, replacing lost fluids or electrolytes. One note with that is like most electrolytes beverages contain a lot of sugar, but I have noticed there are quite a number of good low sugar electrolyte beverages on the market now. Pedialyte can be used in adults to treat diarrhea or kind of replace those electrolytes. It's not just for kids, and that is a really good low sugar option as well. So in summary, for short term, you can use famotidine, Tums, if you're kind of having short-term symptoms. If it's kind of ongoing, it's not really helping with those. Trying a 1 to 2 week trial of omeprazole or lansoprazole, that's definitely a good idea. It's also kind of convenient. They kind of package them in like 1 or 2 week supplies over the counter, so you can kind of just buy what you need and try that out. If gas is an issue, it's usually food related, so eliminating those foods that are causing it. It's usually like dairy or like beans. Trying fiber supplements or Miralax, that's definitely recommended before trying stimulant laxatives. And then as always, making sure we drink plenty of water will always help with any issue over the counter. If the symptoms are ongoing or worsen, it's always a good idea to kind of limit what we're doing over the counter and see a provider. So pain and fever medications. Acetaminophen or Tylenol, generally this is the most safe over-the-counter medication and the most safe option in older adults. This is just because there's less drug and less disease state interactions with Tylenol. Kind of the exception being patients who drink a lot of alcohol or patients who have liver disease. There are many, many different forms and strengths of acetaminophen available over the counter and in prescription options. I always think that it's kind of unnecessarily the most confusing and insidious pain reliever that you can get. Again, because regular strength, extra strength, arthritis pain, those all mean different strengths of tablets. But then when you get into the abbreviations, APAP, paracetamol, acetaminophen, those all mean the same thing. So you have to be really, really extra careful with Tylenol just to make sure that you're taking what you think you're taking. Just because it says acetaminophen on it doesn't mean that, because you took 2 tablets yesterday, that means 2 tablets are still appropriate. It all just depends on which formulation, which type you have. So currently the maximum recommended intake for Tylenol is 3,000 milligrams from all sources. It was recently lowered from 4,000 milligrams. Again, it's very common in combination medications. So those are just a few examples. I think it's almost every combination medication you can get over the counter. So being really intentional about reading our labels and watching for unintentional sources of acetaminophen is a good idea. Again, it's one of the most common over-the-counter medications for accidental overdose. Basically, if you take something like 25 regular strength or 15 extra strength Tylenol in one dose, that can be a potentially fatal overdose. Or even taking, 4,000 milligrams or more for about a week, that will start to show on liver function tests. So it's really easy to take too much. and it's very noticeable very fast if you have taken too much. So the second category, mainly over-the-counter of pain medications, is our non-steroidal anti-inflammatory drugs, or NSAIDs. Ibuprofen we have, which is a little bit shorter acting, or naproxen, which is a little bit longer acting. Again, aspirin is mostly there, but that's usually used as a cardioprotective medication, not necessarily usually as a pain reliever. These really you want to avoid in patients with chronic kidney disease. Patients taking blood thinners definitely should not be taking these. And then overall, patients with a high risk of bleeding, we want to avoid these medications. Again, going with our bleed risk, there is a stomach bleeding warning with NSAIDs, and it kind of applies to our older population, age 60 or older, any patient that has history of bleeding or stomach ulcers. Again, taking blood thinning medication, taking other medications that have NSAIDs, those just increases our bleeding risk, and then having 3 or more alcoholic drinks in a day while using also increases our bleeding risk. So just being very mindful that they do increase our risk of bleeding, and we do need to watch for that if patients are taking these. So for headache, there are a couple of main products over the counter. So there's an acetaminophen, aspirin, and caffeine product that's typically called Excedrin or Excedrin migraine. I'm just going to let everyone know that Excedrin and Excedrin migraine are the same product, just in different packaging. Basically, when they wanted that migraine indication, they had to resubmit to the FDA, so they just leave it in separate packaging. But generally, it's the same medication in the same doses. The caffeine in these is about equivalent to 1 cup of coffee, so it is possible for you to kind of just like fake it on your own if you take, a regular dose of ibuprofen, a regular dose of acetaminophen, and a cup of coffee. You can kind of make that work until you're able to get these if you want to. There is an option without aspirin for patients who have a higher bleed risk. That's just acetaminophen and caffeine. Otherwise, just using our over-the-counter pain medications themselves are also options for treating headache. For urinary pain, you are really looking for an ingredient called phenazopyridine. This is an oral pain medication that specifically works and acts in the urinary tract. Usually it's called urinary pain relief. It is important to drink it with plenty of water, and it is very kind to warn patients, if you recommend this to them, that it does turn your urine an unusual color. So that's not alarming. That's normal with this medication. I do give a special warning with this one that there are many, many other azo and urinary pain products available over the counter, but most of them do not contain phenazopyridine. I think the most common mistake I saw people make when I worked retail was that they would buy the azo cranberry thinking that was going to treat their urinary pain, because that's kind of a common thing. Cranberry is good for your urinary tract, but that doesn't have any phenazopyridine in it, so it's kind of just not a good use of your money. So always checking the label before purchasing is a great idea with these. Again, in summary, acetaminophen, especially for older patients, is usually our safest choice, but just being really careful about formulations and daily limits, and avoiding patients who have liver disease. NSAIDs are great choices for inflammation, but they do have a lot more drug and disease interactions, so just being mindful of that. Again, medications that are specific for headache are just combination medications of things that a lot of people already have. So it may not be necessary to go out and get a new medication. I know a lot of people swear by those medications. I'm not telling them that that's not a good idea either. And then if there are urinary symptoms, just be sure that you're getting a urinary pain product that contains phenazopyridine. And if any kind of pain is ongoing or gets worse, then it's time to kind of talk to a provider. So, newer over-the-counter medications. I just want to point out that Narcan's available over-the-counter now. This is a medication to reverse opioid overdoses. You can get a 2-pack. It's about $45. Otherwise, there's a program from Naloxone, Iowa, that you can potentially get at no cost. Patients who have prescription opioids, as well as opioid use disorder, either of these types of patients can benefit from having Narcan as part of their first aid kit. I know a lot of patients with prescription opioids especially feel kind of judged for having Narcan on hand, but I usually just kind of warn them, like, you never know what can happen. People can get into your medications. Kids can get into medications, and having Narcan on hand can really save someone's life. So just being mindful that people do feel some judgment, I have noticed with these, and trying to dissuade that. So other considerations with over-the-counter medications. This is a question I get a lot, just kind of what's the difference between brand name and generic medications, and does it really matter? The short answer is no. So the active ingredients are the same in brand name versus generic medications. The risk and benefits are exactly the same. What's different is that there are a little bit of inactive ingredients difference. Again, the brand name drug had to go through the FDA approval, so those are usually higher cost, whereas the generic drugs can kind of piggyback off that approval that the brand name got. So those are typically lower cost, and then they can be a little bit different in the variability of drug in there, but they do have to be, they do have to show that they're clinically equivalent. So when people ask me, should I get generic, should I get brand name, which one should I get? I usually just point them to whichever one is currently the cheapest one available. Because again, they do all have to show that they're equivalent to each other, that they all work the same as the brand name. So just get whatever's cheapest. There are a few reasons that a brand name or a generic medication may be preferred. Cost is a big one. If you maybe don't want to spend for a brand name medication, getting a generic one's a great option. Taste is a big one. I know that, I had a friend in college who always wanted to buy brand name Advil because it tasted like Skittles, where generic ibuprofen tastes pretty bad. Inactive ingredients, especially if there's an allergy to an inactive ingredient, maybe you want to do the brand name instead. Maybe you just are experienced with one medication over the other. I think this happens a lot with Excedrin or headache products. I know Excedrin works to treat my headache, so I want brand name Excedrin. That's totally valid. And then maybe that's just what your provider recommended. I know I was at the optometrist the other week and was asking about eye drops, and she said, there's been a bunch of recalls on generic eye drops, but the brand names haven't been affected. So for now, you might want to try buying a brand name. So again, providers often know some things about or have experience with that medication, and so it's always a good idea to get a recommendation from them and see if they have an opinion. Another question I get a lot, especially with older patients, is, my medication has this expiration date on it. Is it really expired? And the short answer is kind of yes. You probably shouldn't be using it anymore. So expiration dating is kind of the time where the product is known to remain stable when it's stored properly. So that's as long as the manufacturer is willing to guarantee the strength, quality, and purity of the product. After that, it may be safe or it may not. There's lots of studies coming out saying that the current expiration dates on medications are often pretty limited. But again, there's no guarantee after that expiration date. Expired drugs might have degraded. They might have a lower strength than they originally did, and they might cause unintended side effects by byproducts of degrading drug. So basically, if a medication is expired in your cabinet, you probably weren't using it that much anyway. It's a good idea to just kind of get rid of it. And lastly, what are some good resources for over-the-counter medications for recommending to patients? Pharmacists obviously are a great resource for over-the-counter recommendations. There's a really great website from ASHP. It's called safemedication.com. And that has a lot of good information about pretty much any medication. A lot of the information is very similarly laid out to the package inserts that come when patients pick up new medications. So if patients have questions about medications, I usually try to point them there. That way we know they're getting kind of validated information and they're not just going to Google and seeing what Google says. Pharmacy Times does a survey every year of pharmacists, and they come out with an over-the-counter purchasing guide. And so that's every year. That's usually findable pretty easily online. Just kind of see what pharmacists are recommending right now for over-the-counter products. Again, the Beers list. This helps point out medications that are potentially inappropriate to older adults. So just keeping an eye on the beers list. They do update it every few years or so, checking medication lists against that. And then just the FDA website. I actually got a lot of information for this presentation from the FDA website. They have a lot of really good resources that are really like clearly laid out for patients who have questions about especially like manufacturing and brand versus generic and topics like that. So that's all I have. What questions can I answer for anybody? I'll say my email's on here too. So if you think of something afterward, feel free to email me. I'm happy to answer questions. Stay after for people who have questions. And yeah, thank you. Thank you again for having me. Thank you to the CME committee for asking me to come. This has been really fun.